We have lots of greenery around the Twin Cities, lots of activities around the lakes, lots of parks to go to, trails, that sort of thing. We have 2 locations, which is Eden Prairie, our Minneapolis location, and Woodbury, our St. Paul location. And we have overlapping programs, but we also have the availability of being able to refer to one another within the Twin Cities. If there isn't a program at one clinic, we can refer to the other one.
Welcome to the Minneapolis Clinic.
I think what's really unique about Rogers is that we are starting with an evidence-based treatment, cognitive behavioral therapy. And we begin with assessments to look at the severity and the symptoms, how they're impacting somebody. That's quite important to make sure that we're getting a good match for the type of treatment that we're providing and that we are able to see if it's working. This is behavioral treatment that has the most impact. People feel the shift. It's wonderful to see.
We're consistently looking at our outcomes. This is something that we have lots of research on, and it's the reason why I'm here at Rogers.
Minneapolis has partial hospitalization, so PHP programs, and intensive outpatient, which is the IOP program. Typically, we want individuals to come to our IOP program after a higher level of care, such as partial hospitalization, and then kind of having that transition to outpatient. We have a really collaborative team, so it's not just the PHP group and the IOP group, so really kind of transitioning and having that continuity of care and providing that really smooth transition.
This is an example of one of our adult program hallways.
We have separate programs and spaces for adults and for people 18 and under, and there's a mix of individual and group therapies and treatments.
Here we have one of our individual office spaces. As we move down the hallway, here is one of our group rooms.
I really enjoy being able to see people experience their aha moments and experience that change and be a part of that. As we had an anniversary kind of coming up, I wanted to be able to provide artwork back to a place that's really helped me grow as an individual, but also a lot of individuals who've come here to seek services grow and learn as much as I can. So actually our manager, Sam, came up with the idea of doing some string art to really emphasize and really highlight the fact that there are many individuals that we have served and there are a lot of connections that have been made. So the idea of each string being connected, and it's one continuous string, it's all interconnected, and Rogers kind of being that central point of how people have grown and learned, and we've been able to serve so many in our community.
We want to meet people where they are and make sure they get treatments that work. That's really what Rogers is all about.